So the golden rule, everybody always asks, so when should I report? What should I report? So now you have the MedSafety app, you have access to it, it's easy to use. So the golden rule is to report anything of concern. So if you are concerned about an adverse effect or a side effect, then you know you need to report it. So how can this be done? It can either be done at a health facility or using the MedSafety app, as Flora has just illustrated, or if you don't know what to do, to phone the COVID-19 hotline. And this will then result in either a paper-based or an electronic case reporting form. So with the reporting of adverse events, these events are either the mild or the minor events, and those are the ones we expected to see from the clinical trials, and they subside usually within 2 to 3 days. But then there are also the severe events. Now, they are less frequent, and they can be either serious or non-serious. And all of these severe events are being investigated. So there are a certain number of very important factors to consider when you do a causality assessment. And this means that you go through a systematic review of all the data, in other words, all the documents and the data collected during the case investigation, to determine whether there is a likelihood of a causal association between the event and the vaccine. So if you find that there is a causal association, so in other words, you find that the vaccine was the cause of this event, it could either be related to the product itself. So this means it could be one of the adverse or the side effects that we know of, or even the ones that are less common. For example, swelling at the injection site. So the person developed a huge or severe swelling at the injection site, then that would be vaccine product related. The next one would be vaccine quality related, and this is very, very rare. So if, like I explained, there's something wrong with the quality of the product. Immunization error related. So if there is a problem with the process of administering the vaccination. And then lastly, a stress-related response. So this happens where people have fear of injections. Then the next one would be inconsistent with causal association. And this is also very common now with COVID-19, where these events take place coincidentally to the vaccination. So the reasons for that is that people have comorbidities. We are vaccinating large populations of vaccinees. Many of them are in the older age groups where they have lots of comorbidities. So if you look at this, you will see that there has been up to the 31st of August, 86 reports of deaths reported following vaccination. And then they, as I explained, must all be investigated. 46 cases are still under investigation, and 40 have been investigated and causality assessed. Now, amongst the 40 that's been causality assessed, none of those were related to any of the COVID-19 vaccines we are using in South Africa. So the causality assigned to these cases could change when new or additional information becomes available or additional cases. Then we would revisit these cases and the causality could then change. The very last one is then the unclassifiable cases, like I explained to you. So this happens at the very start of the process, where cases could be completely ineligible, where you just have virtually no information available, or it could happen towards the end of the process where you don't have enough evidence to say for sure this was not caused by the vaccine, or yes, it was caused by the vaccine.
We have the frequently reported adverse events following immunization, and these are the ones that actually we classify them to be non-serious in most cases. As you can see, our leading one is actually headache, followed by the local reaction, and then we have pyrexia, basically, which is fever or high temperature, and then we've got dizziness.